Coming up today, life-changing surgeries. Losing weight was just the start of one woman's journey to a better life. We explain the pain she lost and the passion she found. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Losing weight typically leads to a much healthier life. And while it's not for everyone, weight loss surgery can offer life-changing results for people living with obesity. But losing weight is not a finish line. Case in point, Tammy Menard. She lost 150 pounds after bariatric surgery. But that was actually just the start. She says the real life-changing surgeries happened after she lost all of that weight. And Tammy is joining us here this morning alongside Dr. Michelle D'Souza, a plastic surgeon here at the University of Kansas Health System. Great to have both of you here with us. We love reuniting patients with their doctors. When's the last time you saw Tammy?
I guess it's been a year already.
Yeah. February. You walked into the studio. What's it like to see a patient along this journey?
Yeah, it made me proud. I'm very happy to see how good she looks, and she's maintained it. And there's been so much work that she's put into it, so I'm happy for her.
Yes. So Tammy, you had bariatric surgery in 2017. Tell us a little bit about the surgery, what type it was, and what it entailed.
Well, I had gastric bypass surgery. I only had to stay in the hospital one night, so I was happy about that. It's a struggle. It's not an easy way out in any means. You have to go, it's a life-changing. Like every day you have to take those vitamins. Every day you have to do everything that they said and still eat and use your tool properly in order to maintain.
What was life like leading up to the surgery? What types of things were you having to do to prepare?
Well, we had to do 6 months of different classes to prepare. We had to see a psychologist to make sure that, we were prepared mentally for this surgery.
Because you said it is not a quick fix.
It's not a quick fix.
It's a long road ahead. Let's get to some before and after photos. We always love to see those. Here's one in your wedding dress. The dress is swallowing you up here. But before the surgery, how was the weight affecting your lifestyle, physically and mentally, as we mentioned?
I couldn't get on the ground and play with my grandchildren. I knew I had to do something, and I never had a weight problem up until I hit like 40, and then I couldn't control it. I was as round as I was tall. And the kicker was, we went to have my grandson Vincent, and I was playing on the floor with my granddaughter Adelina, and I could not get back up by myself.
And that was your aha moment, if you will.
I needed to do something.
So how quickly after the surgery did you really notice the weight coming off?
I noticed the weight coming off pretty quickly. And each pound felt good. Every time I stepped on the scale, it was like, OMG, this is awesome. I am going to get back down to where I need to be. And it was motivating, but there was troubles along the way. There was different...
What were the challenges?
Eating. What I could eat, what I couldn't eat. Even though I practiced it for 6 months, it literally was, I still want that, but I can't have it.
Like what?
Chocolate.
That's tough.
Not really, because it makes me sick every time.
Right. Okay. So, and you hear that a lot.
But I had to, you have to try it, and you still fall, and you still have to get back up on the horse. But literally, it was life-changing. And as long as you do what you're told by your physician, it's easier.
It's possible.
It's possible.
So we know that part of losing excess weight or excessive weight leads to excess skin. So talk about that process. You lose the weight, and then we're going to talk to Dr. D'Souza about what that consult was like. But tell us about what went into that decision. Is that something you knew you were going to have?
Yeah, well, I tried everything first. I started teaching water aerobics, and I started teaching pound exercise and a little personal training, and it was hard to exercise. I had all this extra skin that I had to tuck in, and it was hurtful. It didn't feel good, and it was getting some rashes happen with extra skin. And so I was talking to my friend Sandy, who said, hey, my daughter works for the best plastic surgeon ever, so that's where it went.
Well, and it's like you said, the challenge is here you are, you've gone through all this work to lose the weight, and then now you have a new problem, which is the excess skin, which is also keeping your lifestyle and holding you back. So Dr. D'Souza, what's it like when you first meet one of these bariatric patients? They've gone through all of this, they've lost the weight, yay, but now we've got something new that we have to deal with. Tell us about the consult.
Right, because coming in, they're very happy that they've lost the weight, but then they struggle with the extra skin. And it's just an addition to, like, that drags them down. And one thing about Tammy, she's like a ball of energy, and she was teaching water aerobics with all this extra skin, and I'm just amazed that people can carry on with all their extra skin, tucking into their clothes, being in the pool. Like, there's a lot of things that she had to go through just to be able to do her day-to-day activities. So the skin was holding her back. So the consultations are often focused on which part of your body is the most uncomfortable to you, which part is causing rashes, which is difficult to get in your clothes. Sometimes there's problems with activities of daily living. So those are the things that we try to suss out in the consults. And then also we focus on which parts are most important. Some people want to focus on their extremities, their arms or legs. A lot of people, their core, their trunk is the most important. Sometimes it's the front and the back.
So is it a one-stop shop there? Are you able to do everything at once, or do they have to come back for maybe a surgery or two if they want everything taken?
It depends on how much they want done, but because we're skilled, trained plastic surgeons, we can combine some of these surgeries together. We tend to limit the length of surgery, so they're not these marathon sessions that have been published in the TV before, but we tend to group things where it's safe and a positive outcome for the patients with one recovery.
So we know a lot of this is cosmetic. Are there medical reasons, though, that people need to get this excess skin removed?
The medical reasons include things like rashes that are failed medical treatment, the excess skin with a significant weight loss. They often have to be at a BMI or body mass index under 30. That's been a relatively recent insurance requirement, which can be difficult for some people. And then, again, activities of daily living, limitations, and then pain.
So what was it like to recover from the skin removal, and then what was life like after you were recovered?
Recovery was easy. I was ready to go home the same day, but Dr. D'Souza made me stay. I was up and running. I was ready to go. It didn't hold me back at all. But the real eye opener is almost 3 or 4 months after, because you're still swollen and you still, I could see the difference, but the big life changing is when all the swelling's gone.
And you said that took about 6 months?
For my breast, yes. For my breast. My tummy didn't take that long.
So throughout all of this, you start up this new fitness habit. Tell us a little bit about how you got into going to the gym and just pushing yourself to the limits.
Well, before weight loss, I tried going to the gym, but I always felt like the fat girl. And I always felt like no one really wanted to help me because I wasn't fit. So as soon as I started losing my weight, I went back to water aerobics, and then I started teaching, and I didn't stop. I just kept getting certified for different things. And then I wanted to help. I knew as a personal trainer I couldn't help buff people that can lift more weight than I can, but I can help another obesity person. And it really could, really is beneficial for them to start in the water. And that's where I started. And once I got down, I think I was down to like 126 when I started doing weights and doing the personal training. I focused more so in the water because that's where I could move and I felt like I was making a difference. And because I felt like I was making a difference and because I could go there, I went there every time the doors opened.
And now you're helping other people.
Not as much as I was. I have taken a break, but I was teaching 6 hours a week water in North Terre and Liberty, and then I'm still subbing at North Kansas City Hospital and Gladstone.
And what kind of activities are you doing? I see these pictures of you and in these sticks. Tell us what that's about.
The sticks are pound. It's a high cardio exercise, and so you do a lot of lunging and squats. I'm not teaching that as much these days, but I'm still doing it at home.
So you talked to us about, you mentioned when you had your breast reduction, and you said the bras are much cheaper now.
The bras are so much cheaper. Like it's already paid for the.
I love it. You got like what, a fourth of like the material you're using. So, but you said that of all the surgeries you had, even when you go back to starting with the bariatric surgery to all of the skin removal, that the breast reduction was the game changer for you.
It was the game changer. My shoulders feel better. My back feels better. I'm not as tired. Like literally even exercising, doing the pound exercise, doing the water, that was a lot to carry. It was a lot to carry, and then when I lost all the weight, you have skin, and I believe skin is even heavier. So it was pulling it down, and I'm pulling off, and it was definitely a hinder.
Well, and we were talking before the show, you said that just even figuring out what kind of clothes that you now get to wear, it's a whole new world. I mean, we're not just talking smaller clothes, but the types of clothes, right?
I would never wear a V-neck. I would only wear high-necked shirts because I literally would wear a bra that was too small and stiff everything I could up there so that they wouldn't look bad.
But here, look at this photo. I mean, that just shows a difference between your confidence and how you felt.
Oh yeah.
Was that fun? Let's just be honest, was new wardrobe fun or not fun?
Oh my gosh. Well, for the longest time I kept forgetting that I had to get smaller clothes, and I would come home with big clothes and I would have to take them back because I didn't realize how small I was getting.
That's good stuff.
Yeah.
But you did mention after that surgery that your breasts were numb for a while. I'll ask you what it felt like, but I wanted to ask Dr. D'Souza why that might be.
I think you mentioned maybe that they were numb before surgery, and then
I didn't have any feeling before surgery.
Yeah. Sometimes when their breasts are large, it's like the nerves are stretched out and they don't perform as well. And so when we make their breasts smaller, sometimes the nerves are just happier, and then you have more feeling. And sometimes people have a little extra sensation that they didn't have before.
Happy nerves, happy breasts.
Yes.
We like that. So how was the recovery with that? And which recovery was maybe the hardest of all your surgeries?
I don't feel like I recover. I bounce back.
You bounce back. I like that.
I have a very positive attitude. I don't worry about it. I just go with it. Probably my tummy, I probably called more than anything just because I had the drainage tube and I was ready for it to get out. And maybe if I ask a lot of questions, they just take it out. But other than that, I didn't have any recovery challenges. None.
Wow. Is that typical?
It can be.
Can
She
be.
did very well.
So she
yeah.
was a good patient.
Yes.
But what kind of advice do you give patients when they're going
Yeah.
home to take care of themselves and trying to bounce back?
So I think part of it's because she was so active before surgery that she also did really well afterwards. So your body's used to a level of activity that you tend to want to maintain. And then we tend to tell people to increase their protein intake, keep walking around, don't just kind of curl into a ball. You want to do your regular routine. If you have to get up and make something to eat, do that, go to the bathroom. Those things, being as normal as possible afterwards is helpful for recovery.
And how soon can people get back? In a perfect world, how soon can
Yeah.
they get back to work and regular life, or
Yes.
their new normal, their new good normal?
It depends on the type of surgery and their type of work. So for the tummy, we do tend to limit patients for about 4 weeks, maybe 3, because it's a pretty intense operation, redoing your core, tightening your muscles, and there's drains. It also depends on the type of work, because some people are, baggage handlers, and they need to be off work
Right.
for a while.
Right. So doctor's orders.
Yes.
as need be. I want to ask you about something. There's a lot of shows when it comes to society. There's a lot of reality shows right now that I've noticed. And the other day I was watching TV. There were 3 going at one time about people losing big amounts of weight. Are those helpful? Do you think those shows are helpful? Tammy, I'll start with you. And are they realistic?
I guess they're only helpful if you have the funds to do it. It's also very upsetting to those that watch it that have no choice or no options, I guess, is how I feel about it.
Do you ever watch those shows?
No.
I
I
find them-
have in the past, but I don't anymore because I just don't know how realistic it can be.
What do you think, Dr. D'Souza? Is it helpful? Does it help change society's thought? Does it help people understand, kind of go behind the curtain when it comes to
Yeah.
obesity? I find them very inspiring, but it's coming from me, which is a different perspective.
Yeah, I think I watch them because they're inspiring too. It also does go behind and shows what difficulties they go through, just like showering, getting out of bed.
True.
Yeah.
And it shows some people have success and some people don't.
Right.
And that, I think it depicts at least the challenges that people are going through. So I wanted to ask you about that because I found that interesting. There's such a multiple amount of those programs out there. Be sure to ask your questions. You can go use the chat on YouTube or Facebook. You can tweet us or email the Medical News Network. Info right there on your screen. Let's check in with Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. Happy Friday.
Hi. Hopefully we're getting back into the normal routine now with the shows and updating the numbers, of course. In this respiratory viral season, we're hoping we've hit a peak as far as number of admissions, not only for COVID, but also influenza and RSV. So I think in the next couple weeks, we'll have a lot better information to see if that is true. Right now, we have 23 active patients in the hospital, much better than the 33 that we saw a couple weeks ago. Still have a couple in the ICU, though, but overall, I think the trend so far is good.
All right, I want to ask you about something. 2024 already shaping up to be apparently a bad year for measles. Here locally, Clay County health officials are tracking down anyone who came in contact with a person who tested positive for measles. And currently there are unrelated active outbreaks happening in Philly, New Jersey, and United Kingdom. So Hawk, measles used to be a big problem. Of course, then we get the vaccine in the 60s. But since then, measles cases, they've been pretty rare. But what do you make of the recent outbreaks?
Again, I think what we have is the best data that we have is that these outbreaks really occur in those populations that are unvaccinated. So I think we do have a lot of recency bias in our everyday lives. I think medicine is one of them because we don't understand what the generations went through prior to vaccination. We do have some pictures here as well about measles. It is not a benign disease. It causes a lot of morbidity. It can even cause mortality or death. This is an old image from the CDC. Obviously, you can look. Your children, if you get measles, you have these lesions all over your body. They can be painful. They can bleed as well. But what we have seen is since the advent of the vaccine, those number of cases has gone down. This is just an infographic, a chart as well from a recent publication. And you can see on the left side of that graph, this is measles and rubella, but you can see those high numbers. And then you see this precipitous drop off, and that's when the vaccine started to become available and those vaccine programs were instituted. So again, measles is not a benign disease. It does cause those significant skin lesions, but it can also cause things like meningitis or encephalitis, which is infection in the brain and the spinal fluid, but also pneumonia. Measles is more of a respiratory disease. And so when people have it, they do breathe it out into the environment. And unfortunately, this is one of the most transmissible diseases. It can hang around in the air for about 2 hours. We know that in 2023 there was a large outbreak in Ohio, and we have some information about that. So just as I said, most of these cases do involve unvaccinated populations. In Ohio, in early 2023, they had 85 confirmed cases. Of that, about 95% of those cases were unvaccinated. So vaccination does work. And just to kind of provide some more information, again, it was not a benign disease. 52% of those 85 cases did have complications, things like otitis media, which is an ear infection essentially, GI problems like diarrhea, and of course pneumonia. They actually had just over 40% of people, of those children, had to go to the hospital as well. So it is very important and can impact people's lives, and especially those children's lives. And what they found was that in 2021-2022 school year, the amount of coverage of children in that Ohio area was only about 88% compared to the national average of vaccine coverage, which is about 93%. I would just like to point out that in Kansas and Missouri, in the 2021-2022 school year, we had about 91% of vaccine coverage. So again, it is a bad disease. It can cause significant disease and even death in some cases, unfortunately. But we have a very good, safe vaccine that has been used for decades and has proven to be safe. One dose will actually confer 93% efficacy against disease, but if you get that full 2 doses, it's up to 97%. So again, would still encourage everybody to get their children vaccinated. If you don't think you are, please talk with your medical provider or your doctor. about getting vaccinated and getting up to date with vaccination. So you should have basically proof of vaccination for immunity, or if you were born before 1957, you will be considered immune as well, because children born before that time, most everybody got that disease. So, but again, can't stress enough that we have a safe and effective vaccine, and it is vitally important to get your children vaccinated against measles.
All right, Hawk, a lot of good information this morning. Thank you so much. I want to get to some questions from our viewers. And actually, the first one is just a comment from Candace. She said she had her surgery 5 years ago. She says, I still struggle with seeing my old self when I look in the mirror sometimes, but she has kept the weight off and she's lost 115 pounds. So congrats to Candace, and thank you for sharing that. On that note, Jeremy wants to know, is there an emotional or psychological aspect leading into and deciding about the surgery? And just FYI, we're going to have an entire program on this next Friday talking about the psychological aspect of massive weight loss. But let's talk about it today. What was it like for you?
I was ready. My mindset was positive. I'm doing this and I'm not looking back. And that's exactly what I've done.
And what got you to that mindset? What did you have any stumbling blocks getting up to it, or was it just a moment you woke up and
No,
said,
I mean,
I'm
I
ready?
tried everything possible to begin with, and I just got to the point where I need help. And so let's just do this. So I made the consultation and went, and it got approved, and I just never looked back.
Never look back. Emily wants to know what kind of eating habits have changed for you. We did talk a little bit about it. Can't do chocolate, and I know you have to watch the amounts, but tell us a little bit more about your diet.
My biggest thing is I eat 6 times a day. I just can't eat a lot. So I basically eat when I'm hungry and only as much as I need.
Is it covered by insurance? What is covered and what might not be covered?
For skin removal surgery, yeah.
Yeah.
The things that are sometimes covered by insurance for skin removal would be like an abdominal, the lower skin that hangs over, not an abdominoplasty, because the abdominoplasty does treat the full height of the abdomen, but for the skin that hangs over, a paniculectomy, sometimes that's covered by insurance. And then breast reduction is another common one, but you have to have enough weight removal with the breast reduction for it to be considered insurance covered.
Any issues with insurance, Tammy?
No, we did. The office, her office is spectacular. Like, they literally held my hand through the whole process, and my insurance did cover. But there had to be certain qualifications, like how much was taken, and I don't really know all that, but they took care of me. The office took care of me. So.
Paul wants to know, perhaps if you've had your surgery done elsewhere, do you have to be referred from a doctor to have skin removal, or can you just place a call and say, this is something I think I need, and come in and be consulted?
If you're going through insurance, some insurances will require referrals. The cosmetic side, it doesn't require referral.
Okay, I have another question for you. Melissa wants to know, what's it like looking at the before and after pictures? Do you like them? Was there a time you didn't like them? What was that like?
I didn't like them for the longest time, and then I felt like I can't help other people if I don't show them the difference. And so I've done Facebook Lives for it. I've really put myself out there.
Well, and like Candace was saying, she goes, it took a long time. She was to look in the mirror and see a different, literally see a different person, not just physically. Did you have that same feeling?
I didn't feel like I seen a different person because for the longest time I never had a weight problem. So I didn't have a weight problem all my life, and that might make the difference. What I seen was, okay, I look better, but am I? So when I go shopping, do I need that XXL? Oh my gosh, I'm actually in a medium. You know what I mean? Like, it was like, the girls at the Buckle love me. They're like, remember when you used to buy these? And they'd hold up the pants. And I mean, I have pictures of that too. I don't think I sent those, but they were fun. You know, I took a lot of people on my journey with me.
I bet.
So
another question was, what's kind of on that note, because you come in touch with so many people and I'm sure you get a lot of questions, but what are some of the top questions you get from people about your weight loss?
the positive ones are just basically, wow, I didn't think it was going to happen. That's a quick fix. You're going to gain it back. I had to hear all the negative along with the positive, and I just kept my mindset as I'm going to do this and I don't want to go back. And I did, just gain 40 pounds back. But then I just lost 38. So it's a struggle.
Tell us about that. I want to hear more about, you start to see yourself creep back up, but then what clicks in that allows you to come back down?
Well, 2020 didn't help any
Does
of
not
us.
help anybody.
Okay, and so I wasn't teaching as much, and we took a little fall. And then when I went back to teaching, I wasn't teaching as much, and I started to creep. And even when I got my breast reduction in December, I wasn't back down to where I wanted to be. So from December of last year to now, I'm probably 44 pounds down or something like that. As I looked at my chart, but I couldn't remember now what it was. But since June was when I'm like, I got to get busy. I didn't go through all this to go back up. So I got busy, and 38 pounds since June.
Wow,
Yeah,
wow.
very good.
And that's pretty amazing when you hear that, right?
Yeah, yeah. I think sometimes it's doing the breast reduction helps because you're not carrying that heavy weight around. A little easier to move around too.
A lot easier to move around, a lot easier to do. We did this class called Barbell Basics. Michael was the best teacher, and he doesn't do it anymore, so I'm a little stressed out by that. But, I could actually, after my reduction, and he didn't get to see that part because, after my reduction, he wasn't teaching. But, or I didn't go back, one of the two. Lifting weights now is a whole different ball game with smaller girls, basically.
Yeah. Smaller girls, yes, I bet, I bet. Last question is, are you at your desired weight? Is there more to go, or are you
I'd
happy
like to
where
go
you're
10
at?
more.
10 more, okay.
That's where I was, 10 more. It was at my smallest, and so I'd like to go 10 more.
I think you've got this. I think you got it.
I'm doing it.
You are doing it. You are doing this. I want to get the takeaways today from our conversation. What do you want people to really walk away with when they hear your story, Tammy?
That anything's possible, and if there's a will, there's a way, and it's really in mindset. Set your mind and get it done.
Well said. Dr. D'Souza, what's the takeaway from your perspective?
I think people tend to wait till the time's right or until they're not taking care of other people for them to do their own skin removal or their breast reduction. And one thing that COVID taught us is that you have to embrace every day like it's maybe the last, and so you want to take care of the things that are bothering you, and then you also have to maintain it. So it's not just the surgery. You have to continue those lifestyle changes.
The work is never done.
Right.
Lifelong. Thank you, Tammy, for being here with us today.
Thank you
and
for
sharing.
having me.
Yes, good. Good to see you today. All right, thank you to all of course, our guests and our viewers for being with us. We want everyone to have a great weekend. Coming up on Monday, head and neck cancers are on the rise, and doctors often know it's there even if they can't see a tumor. How oncologists decide between starting treatment or searching for the cancer's source. We'll see you Monday.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now, everywhere podcasts are available.